So, welcome, David. Thank you very much for agreeing to do this podcast with us. But before we go to your recent research, what intrigued me was when I was looking at your profile and looking at your research over the years, it struck me that you have changed the domain in which you have been working. So, for several years, you worked into organization learnings and those, and now you're working in the health in poor countries. How did that shift occur?
Well, I read a book called The 7 Habits of Highly Effective People, and it asked a question, what do you want people to say at your retirement party? And I thought, I want them to say I work on the most important question where I thought I could be useful. So I'd been studying bad management at big American companies, which is a very important question. And I thought the health of children in poor countries was even more important. And so I started studying health in poor places.
Okay, so that's how the shift happened, and you began working in, you have worked in Bangladesh, you have worked in India, in Kenya, I guess, Uganda, several places. And you have used this approach of design thinking and how to apply design thinking to make the behavioral change. And so, can you tell us about what is human-centric approach, or how do you go about it?
So the jargon of human-centered design or design thinking, to me, just means respecting how ignorant I am. I'm a professor at Berkeley. I think I'm very smart. But the men and women in Kenya or in rural Tamil Nadu know a tremendous amount that I don't. And so when the doctors say that this water filter or this cook stove or whatever is useful, my job is not to tell these people, but to learn from them what are the obstacles and to come up with ideas for solutions, but very often to learn from them their ideas for solutions and try to take those to scale. So just today we were working on something with domestic violence. And when I was here a year ago, I worked very hard on how would we reach the women's group? Well, that's easy. How do we reach the husbands? That's very hard. And I had lots of ideas what I thought were very good, and they didn't work. And then when we were in a very poor colony in rural Tamil Nadu, a woman said, we need a poster. She said the poster will show a woman being beaten, her calling 181, the helpline, and the husband being arrested. I thought that was brilliant. And we drew that poster, and then today we showed it to some of the women who work at this university as gardeners and cleaners. And this beautiful poster that I thought was perfect, they didn't understand. And they told us how to make it more clear. And so we'll continue to be learning. I have students who volunteer who are much better artists than maybe the women teaching me, but together we can make something that's effective, and that's true promoting hand washing in schools or trying to sell a cook stove that's less smoky. Design thinking just means I have to understand the people I'm trying to work with and assist, and always realize how much they have to teach me, both in understanding the barriers and in overcoming them.
Right. So this also tells us about how much research is the process of iteration, and we have to keep on improving, and several ideas may not work. And, after, lot of iterations, finally we'll get to the idea which may become successful. So if you come to your study about cook stove, you mentioned it just now. What were the learnings there? What eventually worked in that particular study? So this was a study about trying to make women shift from traditional cook stove to more fuel efficient and better stoves with less smoke and so on.
So initially I was trying to work with more efficient wood or charcoal stoves or dung. And we saw innovative designs that were much more fuel efficient. So if you were buying charcoal, you could pay for this efficient stove in just 6 or 8 weeks. But almost nobody was buying it. And so we thought about all the barriers, and do they not understand the health problems from smoke? Do they not understand how quickly it pays for itself? So we came up with various messages. If they, all of these people are living in a world that I would die in, but I'm much better at spreadsheets than most of them. So we did an intervention where we showed them how quickly it paid for itself. We did the math for them. We did an intervention where we explained the health messages. Neither of those turned out to be very useful. But when we said, look, instead of paying 2,000 rupees roughly to save 400 rupees a week, I hope I'm getting the numbers right. I didn't plan ahead on this. We'll just charge you 500 rupees a week. So you're mostly paying for the stove out of the money you've saved on charcoal that week. And that turned out to be tremendously important. So just the challenges of saving up a couple thousand rupees was really a big help. People, we told them this will save you a lot of money. They didn't believe us. Of course they didn't, because they're told all sorts of crazy things all the time, just as you and I are. So we said, look, try it for a week. If you don't save any money, just give it back. And that turned out again to be very helpful. So we tried lots of things. They all made sense. And before we did the research, we didn't know what would work. It turned out, even when they had a new stove, they still used their old stove.
Okay.
And so in India, the Ujjwala program, PMUI, has distributed almost 100 million LPG stoves.
Right.
And these gas stoves are much safer than traditional biomass wood or charcoal or cow dung stoves. Maybe 1 million children are dying this year because of smoky cook stoves. It's tremendously important. So distributing 100 million stoves is phenomenal, but almost all those families are still using their old stove. So again, we talk to the villagers, we try to understand the barriers. It turns out you have this big cylinder. When it runs out, you have to save up money for the new cylinder or convince your husband to save up money. You have to call the distributor, and maybe they don't deliver for a week or two. So you have to use your old stove between cylinders. The people in rural areas who are less poor own 2 cylinders. And so when one runs out, they use the other. So we said, we know as long as the old stove is there, people will use it. That in my kitchen, we have a stove, a toaster oven, a microwave, a water heater, a teapot. We have many ways to heat. So of course, people use all the appliances they have.
Ways.
So we said, look, we'll give you a free trial of a double cylinder, but only if you fill your old stove with pebbles or if you destroy it. You can still have an outdoor one, but get rid of the indoor one. And obviously, in 20 minutes, you can remove the pebbles. In an hour and a half, you can build a new stove. But we found almost everyone accepted this offer. And 2 months later, at the end of the free trial, 70% of them purchased the double cylinder or paid the deposit and had not rebuilt their old stove.
Okay.
So this is very inexpensive. That the government spent, quite 20 times as much subsidizing the first cylinder than a free trial of a second cylinder.
Right.
And we had an enormous success in getting people to get rid of their old stove.
Right.
Now, that was only in one small study. We have to redo this again.
Right.
And make sure that this actually generalizes it. We're trying to do that in a few new districts.
So what it also shows is willingness to pay for the second cylinder was there. Just that someone had to give them that option, that use it first. And you can pay for that if you find it useful, or in the previous example, pay as you go, or what we call here EMI, equivalent monthly installments. So in India now a lot of things are available. So relatively poor people also can buy durable goods and so on EMI. So they just buy pay as you go. So that has turned out very well in general. So other study that comes to mind that you have been doing is about hand washing is of course there, but also about I think how the government should have the transparency in terms of whatever interventions they do. They should be doing some impact analysis whether it has worked on or not worked, right? And you did one study here in India where it showed that maybe the success has been claimed, but the intervention has not been that successful. And if I remember, that study was about ORS intervention,
So
about that the government of India did. So
I apologize, but when you work on health, you spend a lot of time talking about poop.
yes,
So ORS is very, very inexpensive. It's mostly just a little sachet of sugar and salt, and it costs almost nothing. A few years ago, more than 1 million children a year around the world were dying from diarrheal diseases. And it turns out if you give them this little sachet mixed with safe water, almost essentially zero die.
Yeah, yes.
Cholera becomes an annoyance,
Yes.
not a
Yes.
tragic epidemic. And every child gets diarrhea, but all of the malnutrition and the long-term harms that come, almost all of these are avoided if you just give children this little sugar and salt mixture.
yes,
It's just a sports drink for little people. Or actually, the ORS came first. Sports drink are a copy
Later,
of ORS
yeah.
for grown-ups.
Yes.
Even though it has this almost magical effect on health, it's not obvious that this is important. That every child, as I said, gets diarrhea. People just think it's normal. It's just part of teething or whatever. So about half the kids in India get ORS when they're sick. We tried a very simple intervention. This was in Uganda, where we just gave the ORS ahead of time. And it turns out if the parents had ORS in the house and the child got sick in the next month or two, they almost always used it. So this is very inexpensive if health workers are already going to houses. And not so much in Tamil Nadu, but in most states, there are ashas that are visiting
Yes, Ash.
houses with children. So I thought this was a very important finding. And after we did the study in Uganda, I realized that India, a decade ago, started a similar intervention. It has the very unpoetic name, the Intensive Diarrhea Control Fortnight. And it's just a very sensible intervention. The ashas are visiting the households. They're given ORS and told to give one to every parent of a small child, the caregiver of a small child. And I was very excited, and I wanted to study this. And I hope to document how well it worked. But when we looked at the data, they did this normally every July, and some data sets collected in India happened to collect data in June, July, and August. We could see if there was a lot
Pre and
more
post,
ORS
yeah.
after, and the effects were very, very hard to detect.
So what do you think had happened? The people had the supplies, but they were not giving, or do we know the reason why it
Well, it's
may
a
have failed?
national program, and as I'm sure you're aware, India has a very complicated system of governance. So some states just ignored the directive to have this.
Okay, so it wasn't implemented
They didn't
well
even
enough.
try. And I think some states tried, and my best guess is not all of the money in ORS made it to the field. But I don't have evidence of that. The government, if you read the protocol for this intervention, it's really beautiful. It's very well designed with all of this monitoring and such. But nobody is willing to share the monitoring data with me. So I don't know how much of this is nobody ever tried, how much of this is somebody tried and the money didn't get to the field. I don't think anyone steals the ORS because it's not worth very much.
Yes.
But somebody might have gotten rich off of this. I don't have any evidence on that.
Okay.
But it's a very exciting opportunity, and if states do try it, I think they can save a lot of lives and improve health substantially because it's very, very inexpensive.
Okay. So last couple of questions. One is, what brings you to India for this particular visit? What are the studies which are currently underway for you?
I have a follow-up to the cook stove study. I said we got this intervention with a free trial of a double cylinder to work well in one district. So we're hoping to do it in 2 other districts, one in Jharkhand, one in Maharashtra. Unfortunately, that study was funded by USAID, which my president has blown up for reasons I'm not clear on. So if any of your listeners want to donate to this study, it could be possibly the most inexpensive way to save children's lives since immunizations. And then we're working with an NGO in Karnataka and with the team, including you and your colleagues here at Great Lakes, to study menstrual cups, which are a reusable menstrual supply, very unfamiliar in most of India, that can save women money, improve their health, permit them to work outside the home or go to high school away from home obviously, much more easily, but has very low take-up. So again, there's a vast number of barriers. It's an unfamiliar and bizarre technology. If you're not used to that, it seems it's just a little tiny cup. It seems like it would leak. And even though it saves money quite quickly, initially you have to come up with 220 rupees, and women in poorer villages in rural India don't always have that money available. So we're trying to figure out how we can overcome these barriers. We're testing if some women have a free trial, will their neighbors learn about it, and trying to see, as with I've done with cook stoves and water filters and such, are these technologies that the doctors say are useful? Are they really useful in the field? Maybe there's no demand because they don't work very well. So far in our pilot tests, the women who've used it have liked it.
Yes.
And so if they are good products for this setting, how can we overcome these barriers and try to give more women control over their lives and their bodies?
Yes. Really, as we started this podcast with really very important big questions, in fact, coming forward. Last one to end with, since we are in business school and you have worked in house business school for so many years, decades now, any specific, not advice, but anything that you would want to say to our students?
When you go to business school, you're surrounded by typically a bunch of academically successful, hardworking people, and a society that emphasizes success is getting a job at Infosys or this investment bank or consulting, and there's no dishonor in that. But there is a real temptation to think that that is what winning means. And that if all my friends have a TV this big and I have a TV that big, I win, but if my TV is this big, I lose. And just to say, it doesn't matter, right? The size of your TV, it just doesn't matter. There's nothing wrong with earning a lot of money. There's also nothing wrong with working on problems that really make a big difference in the world. I checked with my wife and my kids, and they all agree that it's okay that I earn less money than I could be if I worked in consulting and such. And for your students and other listeners of this podcast, you don't win by making money, you win by having a good life. And for me, working on these important questions really adds value to my life, much more than having a bigger TV.
On that wonderful note, thank you very much, David, for talking to us.
It's an honor to be here.
Thank you.